Pneumonia is a serious infection that affects the lungs. It can strike anyone, regardless of age or health status, making it a significant concern for public health. It inflames the tiny air sacs in your lungs, called alveoli. These alveoli are crucial for breathing, as they facilitate the exchange of gases that keep us alive. These sacs are responsible for taking in oxygen and releasing carbon dioxide. When functioning properly, they ensure that our bodies get the oxygen needed for all cellular activities. When they are inflamed and filled with fluid, it becomes difficult to breathe. This can lead to severe respiratory distress, making everyday activities challenging and sometimes requiring medical intervention. Pneumonia is a major global health concern. It is one of the leading causes of illness and death worldwide, particularly in vulnerable populations. It affects millions of people each year, leading to hospitalizations and even death. The burden on healthcare systems is immense, with resources often stretched thin during peak seasons. Understanding pneumonia is the first step in protecting yourself and your loved ones. Awareness and education about its symptoms and risk factors can lead to early detection and treatment. Pneumonia can affect anyone, but some people are more at risk. This includes young children, older adults, and those with chronic health conditions, and people with weakened immune systems. These groups are more susceptible to severe complications, making prevention and early treatment even more critical. The good news is that pneumonia is often preventable and treatable. Vaccinations, good hygiene practices, and timely medical care can significantly reduce the risk. By understanding its causes, symptoms, and treatment, we can reduce its impact on our lives. Staying informed and proactive in health management can lead to better outcomes in healthier communities. Pneumonia can be caused by a variety of germs, but bacteria, viruses, and fungi are the most common culprits. These microorganisms can invade the lungs and lead to a range of symptoms, from mild to severe. Understanding the differences between these germs is crucial for effective treatment and prevention. Each type of germ causes pneumonia in a slightly different way. Bacteria, viruses, and fungi have unique mechanisms of infection and impact the body differently. Recognizing these differences helps healthcare professionals tailor their approach to treatment. Bacterial pneumonia is often the most serious type. It can develop rapidly and cause significant health complications if not treated promptly. Symptoms can include high fever, chills, and difficulty breathing. The bacteria Streptococcus pneumoniae is a leading cause of bacterial pneumonia in adults. This bacterium is particularly dangerous because it can evade the immune system and multiply quickly. These bacteria can multiply rapidly in the lungs, leading to severe inflammation. This inflammation can cause the air sacs in the lungs to fill with fluid or pus, making it hard to breathe and reducing oxygen levels in the blood. Viruses are another common cause of pneumonia. Unlike bacteria, viruses invade the cells of the respiratory tract and can spread easily from person to person. The viruses that cause the flu and common cold can also lead to pneumonia. These viral infections can weaken the immune system, making it easier for pneumonia to develop. Viral pneumonia is usually less severe than bacterial pneumonia, but it can still be serious, especially in young children and older adults. These groups are more vulnerable to complications and may require hospitalization. Fungal pneumonia is less common than bacterial or viral pneumonia. Fungi are typically found in soil and can be inhaled into the lungs, leading to infection. It typically affects people with weakened immune systems, such as those with HIV/AIDS or those undergoing chemotherapy. These individuals are less able to fight off infections, making them more susceptible to fungal pneumonia. Early detection and treatment are essential to prevent severe outcomes. While most cases of pneumonia are caused by infections, aspiration pneumonia is different. It occurs when foreign substances such as food, liquid, or vomit enter the lungs. This is more likely to happen if you have difficulty swallowing or if you have a condition that affects your gag reflex. When these substances enter the lungs, they can irritate the air sacs and lead to inflammation. Aspiration pneumonia can be serious, especially if it is not treated promptly. If you experience difficulty swallowing, it's important to seek medical attention to rule out any underlying conditions. Recognizing the symptoms of pneumonia is crucial for seeking timely medical attention. The symptoms can vary depending on the cause and severity of the infection, but some common signs include a persistent cough is a hallmark symptom of pneumonia. The cough may produce phlegm, which can be green, yellow, or bloody. Fever is the body's natural response to infection. A high fever is a common symptom of pneumonia. As the air sacs in the lungs become inflamed and filled with fluid, it becomes harder to breathe. Shortness of breath is a serious symptom that should not be ignored. Section 5. When to seek help. Recognizing severe symptoms. Understanding when to seek medical help can be crucial in managing pneumonia effectively. While some symptoms of pneumonia, like a mild cough, can be managed at home with rest and over-the-counter medications, it's important to seek immediate medical attention if you experience any of the following severe symptoms. Early intervention can make a significant difference in the outcome. Difficulty breathing or shortness of breath that worsens over time. This can be a sign that your lungs are not getting enough oxygen, which is a serious condition that needs prompt medical attention. Chest pain that gets worse when you breathe or cough. This could indicate that the infection is spreading or that there is inflammation in the lining of your lungs, both of which require medical evaluation. Confusion or disorientation, especially in older adults. This can be a sign that the infection is affecting your brain or that your oxygen levels are dangerously low. Bluish lips or fingernails, indicating low blood oxygen levels. This is a critical condition that needs immediate medical intervention to prevent further complications. Persistent high fever that doesn't improve with medication. A high fever can be a sign that your body is fighting a severe infection, and if it doesn't respond to treatment, it needs to be evaluated by a healthcare professional. These symptoms could indicate a severe case of pneumonia that requires prompt medical intervention. Delaying treatment can lead to more serious health issues. Ignoring these signs could lead to serious complications, including respiratory failure, sepsis, or even death. Always err on the side of caution and seek medical help if you're unsure. Section 6. Diagnosing pneumonia, from exam room to laboratory. Diagnosing pneumonia typically involves a combination of a physical exam, medical history review, and laboratory tests. Your doctor will begin by asking about your symptoms and medical history. During the physical exam, your doctor will listen to your lungs with a stethoscope for any abnormal sounds, such as crackling or wheezing. This helps them assess the severity of the infection and determine if there is fluid buildup in the lungs. To confirm the diagnosis and identify the cause of the pneumonia, your doctor may order additional tests. Section 7. Chest X-rays, a vital tool in pneumonia diagnosis. Chest X-rays are one of the most common and effective ways to diagnose pneumonia. These images allow doctors to visualize the lungs and look for signs of infection, such as inflammation, fluid buildup, or abscesses. By examining the patterns on the X-ray, doctors can distinguish between different types of pneumonia. For example, bacterial pneumonia often shows up as a consolidated area of white on the X-ray. Chest X-rays are a safe and painless procedure. They provide valuable information that helps doctors make accurate diagnoses and determine the best course of treatment. Section 8. Combating the infection treatment options for pneumonia. The treatment for pneumonia depends on the underlying cause and the severity of the infection. Bacterial pneumonia is typically treated with antibiotics, while viral pneumonia is usually managed with rest, fluids, and over-the-counter medications to relieve symptoms. Your doctor will determine the appropriate type and duration of antibiotic treatment based on the specific bacteria causing the infection. It is crucial to complete the entire course of antibiotics as prescribed, even if you start to feel better before finishing them. Section 9. Beyond antibiotics, oxygen therapy and respiratory support. In severe cases of pneumonia, hospitalization may be necessary. If you are having trouble breathing, you may need oxygen therapy to increase the levels of oxygen in your blood. Oxygen therapy can be delivered through a mask or nasal cannula. In very serious cases, you may need to be placed on a ventilator. This is a machine that breathes for you, giving your lungs a chance to rest and heal. Section 10. Preventing pneumonia, your best line of defense. Preventing pneumonia is always preferable to treating it. There are several measures you can take to reduce your risk of developing this serious lung infection. Vaccinations are one of the most effective ways to prevent pneumonia. The pneumococcal vaccine protects against Streptococcus pneumoniae, a leading cause of bacterial pneumonia. The flu vaccine can also help prevent pneumonia by protecting against the influenza virus. Good hygiene practices are essential for preventing the spread of germs that can cause pneumonia. This includes washing your hands frequently with soap and water, especially after coughing or sneezing. Section 11. Conclusion. Staying informed, staying healthy. Pneumonia is a serious lung infection that can affect anyone. By understanding its causes, symptoms, and treatment, we can take steps to protect ourselves and our loved ones. If you experience any symptoms of pneumonia, it's essential to seek medical attention promptly. Early diagnosis and treatment are crucial for preventing serious complications. Remember, prevention is always the best medicine. By staying up to date on vaccinations, practicing good hygiene, and maintaining a healthy lifestyle, we can significantly reduce our risk of developing this potentially life-threatening infection.